back to my channel. So apologies that this is taken so long to get online. I've been trying to record this video since beginning of August, which was Gastroparesis Awareness Month, and even now I have tried to record this video. This is my third attempt today because of distractions and things that have happened in my household. I apologise in advance for any noise in the background, whether it be the dogs playing, the fan in the background that is intermittent, which is just my wheelchair charging, or anybody coming into the room or whatever. I apologise, but I really want to get this video sorted, done and uploaded. So today's video is going to be about gastroparesis and what that is. I know I've done a few videos with regards to my gastric emptying study and what that meant for me, but I've not actually done a video about what gastroparesis is, and this is what this video is about today. So I'm going to talk about what gastroparesis is, and I'm also going to talk about what symptoms it can cause, what doctors can do to try and alleviate the problems that it can cause, and then obviously how it's diagnosed. So gastroparesis is basically what it sounds like. It is paralysis of the stomach, or better known, it is a chronic health condition that is incurable, which basically means your stomach doesn't work as efficiently as it should do. Now, I have done some diagrams to explain this. Now, as you all know, if you've watched my gastric emptying study video, you will know what I had to eat for that study to be done. So it's based on like a sandwich. So you're basically given one egg that's scrambled, 2 pieces of bread and a glass of water. So it's just like eating a sandwich. So I'm going to base my illustrations on somebody who's eaten a sandwich. So a small sandwich would take the average person who does not have gastroparesis around an hour and a half to maybe 2 hours for at least 95% of that sandwich, or the whole sandwich, to be completely digested, basically. So I've done some illustrations to show you how the stomach works, what a normal stomach can do, and what a gastroparesis stomach does as well. So anybody who has that gastroparesis, that sandwich that would normally take an average person that does not have gastroparesis 1.5 to 2 hours to digest, somebody with gastroparesis, that sandwich would take a hell of a lot longer. So here's my illustrations. I apologise that some of them look like fat chickens and very skinny flamingos, but I'm not an artist, so please don't laugh. So here are my, upside down. So here are my skinny flamingos and fat chickens, okay? So this works as the esophagus, has a sphincter at the bottom of it. This is your stomach. This is your duodenum with a sphincter at the bottom of your stomach. And your stomach naturally has, in the shaded area, naturally has bile and acid in your stomach at all times to basically break down saliva, any liquids you drink, any food you eat, any tablets you take, things like that. Because when you take them orally, you may chew that food, but it still needs to be broken down a little bit, because as you can appreciate, your stomach is probably about the size of your fist, and you're trying to get it into like a tube. So, you know, that tube is a lot smaller than your fist. So obviously the food needs to be broken down a lot more. So that is basically what your stomach does with the acid and bile that's within it. And every time you swallow, your stomach contracts. So I've done the contractions like this, squiggly little lines at the side of your stomach. So here's the food going into your stomach, demonstrated by these lovely green blobs. The food then goes into your stomach and then is obviously digested bit by bit over a course of, say, for a normal person, 2 hours, if it's a sandwich. Takes about 2 hours to be digested. And then once the food is digested, these sphincters here, which you can see here, is open, and the food, little by little, with each contraction, goes through into your duodenum, which then leads on to your small intestine, your jejunum, which then absorbs all the nutrients your body needs and gets rid of the waste products that your body does not need. For somebody with gastroparesis, your food will go into your stomach. The food may or may not digest very well at all. The contractions of your stomach may be extremely weak or just fluttering, and you may or may not end up with tiny little driplets of that food going into your duodenum, but as you can see, clearly not as much. and therefore it takes a lot longer for your stomach to empty. It also takes it's a lot harder for your stomach to absorb the nutrients that your body needs. And therefore you can then lose weight very quickly, and you can also become malnourished because you're not getting what your body needs. And ultimately this food will stay into your stomach a very long time. So eventually, like any muscle, your stomach can tire, and that food will then stop digesting and stop going through here, and the rest of it will just sit in your stomach and eventually cause irritation and then come back out. Now this happens for a variety of reasons, and can happen in different time frames for different people. Some people, the stomach may not be happy with anything that they put in there, so they'll automatically just bring it straight back. For other people, they may be able to take some medications and they may be able to stay down, but eventually the water that they've took to take that will eventually come back up. And this can take anything from maybe minutes to hours, you know what I mean? But it's not going to take days and days and days, because eventually you will end up bringing that back up. In the very, very rarest of occasions, you may end up keeping that food in there for a long period of time, and if that happens, you can cause what's known as a bezoar, which is basically hardening of the food in your stomach, which obviously would then be even harder to get out. And then it can also cause gastric ulcers, because as you can appreciate, the more things that are in your stomach for the longer period of time, the more acid is produced in your stomach to break that down, which then can cause gastric ulcers. Now, I personally have had what's known as a bezoar, but luckily I was able to bring that back up. It wasn't very pleasant. It was almost like I basically just swallowed a bunch of cardboard and it'd been mulched up, and then I was just bringing it back out, almost like bringing up a very thick paper mache. Sorry for the TMI. Don't worry, this video will be linked with a trigger warning. So, you know, at the end of the day, it's not very pleasant, and most people do not bring up bezoars at all because they become very hard lumps, and before they've even know they've got one, it's become too solid. Now, that is basically how gastroparesis works, so I hope that helps. Now, what can gastroparesis cause? Well, we've already spoke about, you know, on the very extreme cases, it can cause bezoars, like hardening lumps, which eventually will require surgery, because not many people are lucky enough to bring up that type of crap that I've just explained. Or it can cause gastric ulcers. But there's things that your body will alert you to let you know there is a problem if you have gastroparesis. So the first thing you will get is you will start noticing you'll get full very quickly. Now, this could be after a couple of mouthfuls of food. For me personally, I only have to take my medication with a mouthful of water and I feel full. Because I've never been hungry and never been thirsty in my whole entire life. So I've just eaten because it's just a normal, natural thing to do, and because I knew I needed to do that to survive. However, now my stomach just decides it doesn't want it anymore. And that's just how my stomach is, because I have severe gastroparesis. But you'll get full very easily and very quickly. You will feel nauseous and possibly even vomit from it, and probably 95% of people with gastroparesis will vomit at some point. You'll get pain upon eating as well, because your stomach will not be happy, so you'll get pain, and you'll also get excessive bloating, even on the smallest amounts of things. I'm trying to think if there's anything else. No, I think that's about it. So these are all the symptoms that I've had, all the symptoms that I've got. But what can we do about these things? Now, obviously, most people, when they first start with gastroparesis, like when I first started with gastroparesis, I didn't even know I had it. I wasn't really getting pain on eating. I was getting nauseous, but I wasn't really getting any pain. And I ended up eating on top of what we now know was the bezoar, and I ended up bringing that back with the bezoar, and obviously that was horrendous because I was choking and everything. Because when you are bringing back up food that is undigested or whatever, you increase your risk of aspirating that and inhaling it, and you also increase your risk of chest infections and stuff as well. You also end up with irritation to your teeth, so discoloration, chipping of your teeth, thinning of your enamel. You also end up with a lot of sore throats and chest infections because of the acid coming back up with it. And you know, these are just some of the smaller things that can happen with gastroparesis. I've already explained some of the severe. Now, gastroparesis mainly affects people who are diabetic, or at least it's more known to affect people with diabetes than anything else. It has been now linked to people with connective tissue disorders like scleroderma and Ehlers-Danlos syndrome, and it can also affect people with a damaged vagus nerve. You don't have to have any of these conditions in order to get gastroparesis, because it can happen spontaneously as well. And it does not discriminate either. So it can happen to anyone at any time, at any age, any size, or whatever. It doesn't matter whether you're tall, thin, skinny, fat, whether you are, you know, black, white, 90 or 9. It can happen to anyone. It's like a one size fits all type of condition. It's just, you know, it can affect absolutely anyone at any given time, and it is not pleasant, as you can imagine. Now, like I said, I used to be able to eat. I wasn't able to eat a lot, but I was able to eat, and I was able to maintain that and maintain myself. Now I can't do that because I think one day my stomach just decided enough's enough. I'm sick of doing this. I've been doing it for years. So yeah, now it does say that if you search online, it will say that gastroparesis, especially with diabetes, is more prevalent in women than it is with men. But like I said, I wouldn't say it discriminates against women and men. I would just say it could happen to anyone at any given time. Yes, there may be more women that is known to have it, but that's because, let's face it, some men have pride and they don't like to get seen very quickly at doctors, and they just go, I'm sure it'll pass. You know what I mean? Like, I originally thought that my problems was down to gastritis or gastroenteritis, and it wasn't. It was down to this, and it took me a long time to kind of get used to it, and even now I'm still not used to it. So what can be done to help? So while you're going through certain tests and procedures and things like that, doctors will do something to help in order to try and minimize your discomfort and your problems. So, and this is even before they probably even know you've got gastroparesis. They will literally do everything they can in order to help. So if you're feeling nauseous upon eating, they'll probably prescribe you an antiemetic, which is an anti-nausea medication, in order to try and dampen that nausea down so that it manage to keep food in your system better. If that is not helping on its own, they may prescribe you a prokinetic medication, which is designed to stimulate your stomach into contracting so that you digest food better, and therefore the mixture of the two usually helps. They usually also recommend that you change your diet, whether it be the consistency of your diet, whether it be how many times you eat per day. So they usually recommend you eat smaller portion meals, like 6 to 8 times a day. They'll also tell you to change the texture of your food. So you may be able, instead of eating as full solid foods, they'll probably tell you to eat certain blended foods or try and mush your food down a little bit. They will try you on different things. Now, for me personally, they didn't believe that I had anything wrong with my actual stomach. They thought I had constipation. So for the first year or so, they were putting me on constant laxatives until I kind of drilled it in their head that that constipation was not my issue. And then after that, I basically was told that they were going to try me on these antiemetics. Now, in the meantime, I had a barium swallow test done, which is a test where they check your swallowing and see how your muscles work in that. That came back to say that I had esophageal dysmotility and mild dysphagia. I also saw a dietitian, And I also, well, I didn't see her, I actually had a telephone consult with her because we were in the middle of the pandemic. And I also had a manometry and pH study at the beginning of last year, which again confirmed my dysphagia and my esophageal dysmotility, but it also showed that I had a mild hiatus hernia, which they didn't need to do anything about because obviously everything is now being bypassed my stomach because I have a feeding tube. And the only reason that I have a feeding tube is because every single medication I tried and every dietary change I made did not work. Now, at one point they had me on 40 sips, which is basically a liquid nutrition that you take orally. The bottles are around this big with around about 125 mils to 150 mils in. I was told to drink 6 of them a day, and I couldn't even drink half of one a day because it was making me too poorly. That's how bad my gastroparesis was, or is rather. And it came to apparent that I wasn't going to sustain myself with food, and I couldn't find an antiemetic or an prokinetic medication that would help me. Now, because I have cardiac related issues, what I didn't know then, which I do now, is medications are on a traffic light system. So for me personally, because I have cardiac related issues, there was green medications that I could take that, you know, had very minimal chance of causing any issues with my heart, but unfortunately caused issues elsewhere, like with my bowel or something else. So I ended up off them and back on amber medications that are to be taken with caution with people with cardiac related issues, but I could still take them under medical supervision. Unfortunately, they had adverse effects, and obviously it caused my heart to fluctuate and cause problems. And then there are red medications, which obviously should be avoided at all costs. Now, there are 2 medications. One's, I think, an antiemetic. The other one's a prokinetic, but don't hold me to that. One antiemetic I'm completely allergic to, so I can't have it. And the other one I'm allergic to its counterpart, which basically means I can't have that one because chances are I'd be allergic to that as well. So I haven't had that either. And the only other medication that I could try is a red medication, which is notorious for causing heart arrhythmias. And obviously I already have a heart arrhythmia, so they can't try me on it. Other things that they can try for people with gastroparesis are Botox, where they inject you in the sphincter of your duodenum. So they basically inject the sphincter to keep it open. However, again, because of my cardiac related issues, that was told that it was probably best that I did not have that, and that was my decision, not the doctor's. That was my decision, just because of the fact I was already having issues with my heart. I didn't want to have something that was technically a toxin injected into a sphincter to keep it open, which is designed to contract, because there is like, I wouldn't say history, but there is like known reports of Botox into a contracting sphincter to cause other contracting muscles to have issues. So obviously with your heart being a contracted muscle, I didn't want to take that risk. So I declined Botox, and plus it's not a permanent solution. They would have to go down endoscopy every few months and keep that sphincter open at all times if it worked anyway. And obviously that's a lot of procedure and a lot of stuff injected for something that's designed to open and close. And eventually it would probably cause paralysis of that sphincter anyway. So I decided against it, and my doctor was fine with that. And there was no guarantee it would even work. It's been known not to work more than it's been known to work. So I told my doctor no. The other thing that you can try is gastric pacing. Now here in England, gastric pacing is not available on the National Health Service. You can only get it on the National Health Service by a handful of doctors, and they will only prescribe it if the National Health Commissionary Board basically states that you are a candidate. So you'd have to go through a candidate screening to see whether they will fund it so that you can have it. It's not something that is known to have a good high success rate, which is probably one of the reasons why the NHS do not fund it automatically. So therefore it was decided better for me not to have that done, again, because it doesn't have a high success rate and it's a big procedure to go through for it not to work. So it was decided again for me not to go through that. But by that point, by the time I had that consultation with regards to gastric pacing, I already had my NJ tube, because it was determined after trialing a nasal jejunal tube last year and then taking me off it and me not being able to sustain my weight or my muscle, it was decided that obviously I can't manage without my nasal jejunal tube, which is why it was given back to me. But like I said, not everybody needs a feeding tube. Somebody who has gastroparesis, regardless of how severe that is, may find a prokinetic, an antiemetic, and a dietary change, or a mix of all three of those things that will help them and will be able to allow them to eat properly and eat orally. Even if they have to blend their food, it will allow them to do that, so therefore they can sustain themselves on food or nutritional drinks. For me personally, that was not something that worked or not something that helped. I even tried mast activation disorder medication, and although that helped my allergies with regards to hay fever and things, it did not help with my stomach in one bit. Because obviously my stomach is not damaged because it's got allergies to it. It just stopped working. So yeah, my last resort and my only form of treatment now is a feeding tube. But like I said, I'm in a small proportion of people that need feeding tubes. Majority of people with gastroparesis will find something that will work within them treatments. The way a gastroparesis is diagnosed is via a gastric emptying study, which is, as I've said earlier, you basically get a small amount of food, like 2 pieces of bread, a glass of water, and a scrambled egg, or porridge, depending on what consistency of food you eat, where you basically eat as much as you can of that food. I didn't eat all of mine because I just couldn't. But you basically eat as much as you possibly can, and then they give you a scan of over 4 hours, and that's usually a number of 6 scans over that 4-hour period. And if your stomach is working sufficiently enough, they should see a 95% drop in food in your stomach within an hour and a half to 2 hours. Probably only a small handful of those people may need to go to the 3rd hour scan, because it may take them just slightly over 2 hours to lose that amount of food. But majority of people will have a normal digestive tract and they'll lose food out of their stomach within 2 hours. For me personally, after 4 hours, I still had a delay of around 2.5 hours. So it takes me roughly on average to eat 1 egg and 1.5 pieces of bread, because that's all I managed on the day, over 6 hours to digest. So, you know, and even now that's even less, because obviously my stomach just doesn't work now. If I put food in, it usually causes so much problems, it ends up coming back out. So yeah, that is basically the gist of gastroparesis. I hope that it makes sense to you guys now. I hope that it explains a lot. So my stomach is basically one of these. So basically it will contract, it will digest food, but very, 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 very slowly, to the point where eventually my stomach gets tired and then anything else gets left behind. And then obviously eventually it comes back out. So that's what my stomach was 2 years ago. God knows what it's like now, because my stomach can't be used anymore. But yeah, I hope this makes sense. I hope that you understand gastroparesis a little bit better now. But that is what gastroparesis is. And yeah, like I said, I just fall in the small minority that need feeding tubes when many people won't. So I hope you've enjoyed this video. If you have, please give it a thumbs up, and don't forget to subscribe so that you can watch further content. If you press the bell, you will be alerted for when I post. And yeah, thank you so much for watching, and I hope you have a lovely week. Bye guys.